Welcome to the pharmacy! Filling prescriptions isn't the only thing pharmacists do. Today we will be exploring the prescription filling process and discovering ways you can speed up the procedure. The first station is the drop-off station. This is where you drop off your prescription and give it to a pharmacy team member. It is also where they gather important information from you, so don't just leave a prescription on the counter and walk away.
Well, hello! Welcome to Drop-Off. Here, we need your name, your date of birth, your address, possible drug allergies where we don't want you to die, other medications you're currently taking, your insurance information, and any other medical conditions that you may have. Also, make sure you let us know if you have your insurance card or if it's changed, because we want to make sure that you get the best price.
The next station is the RX filling station. This is where we process your prescription.
My name is Tiffany, and I'm going to talk to you about prescriptions. Some things that we may run into a problem that may take longer to fill a prescription is the doctor may not put their name on it. I don't know why they do that. They may forget the quantity or the strength of the medication. I don't know how they expect us to fill it. It's like a guessing game. I guess I didn't take the mind reading class that they wanted us to take. Anyways, without that proper information, we cannot fill a prescription because it's technically illegal. It just depends who you are. Maybe we'll make an exception. Just kidding. Another thing that may happen is the insurance may not want to pay for the medication. So what that means, guys, is that the doctor's office and the insurance company, they have a fight. And whoever wins, basically, they eventually let us know and we'll run the prescription or they'll change it to something else. But that's the day in the life of the pharmacy, guys. Have a great day!
The next station is the fill station, where we assemble your prescription.
At this station, we take the label that printed off at the previous station and assemble the prescription. We're all assigned a name tag so they can track down to see who assembled the prescription. So we scan our name badge, we scan the label, and then we scan the prescription bottle. If you scan the wrong one, it'll make a sound like this, letting you know you selected the incorrect drug. So then you'll have to redo it. So if you scan your name badge, you scan a label, and then you scan the drug. And that's to let you know that you selected the right drug. So then we'll count by 5, and this is so we can count a larger quantity more efficiently. And then we'll put it in a bottle. Put the label on there, and then the pharmacist will now verify the prescription.
The next station is the pharmacist verification station.
Phew, you made it to the final step of the prescription filling process. This is where I check for accuracy, correct dosing. I also check for drug interactions and allergies, all to make sure the prescription is safe for you. Now next I'll show you a couple of other things that I do here in the pharmacy. Oh, hi there. I was just logging in my controlled substance order for today. This is just one of many things that we do to keep track of controlled substances and prevent theft here in the pharmacy. We also perform a monthly inventory on these drugs, and only the pharmacy manager can order them. So all of this is very time consuming and can take away from my other responsibilities here in the pharmacy. I have all these books around the pharmacy, but I don't need them because I know everything. Just kidding. The world of pharmacy changes very rapidly, so there are times when I have to look up information. We mostly use an up-to-date database like facts and comparisons, but I have these other references around as well, especially the Texas Pharmacy Law Book. Here in the pharmacy, our phone takes up a lot of our time during the day. Comunicamos con doctores, pacientes, otras farmacias, y compañías de seguranza. And doctors oftentimes leave prescriptions on our voicemail for patients. Let's listen to one now.
Hello, my name is Dr. I Feel Good. I'm calling in a prescription for one of my patients. The name is Spanky Mullins. I need Xanax, the bars, 2 milligrams. Take 2 bars. I need tablets 4 times a day, and I want to give about 540. It's 540. The next one is for the hydrocordones, 10/325. The directions are 2 tablets 4 times a day. I want to give 540. The patient only wants the yellow ones. The other ones, they don't work. Next prescription, subscription is promethazine with codeine, 2 tablespoons 3 times a day. And I want to give a quantity of 1 whole bottle. It has to be the purple Actavis brand. Patient's allergic to the red kind. My DEA is DN4536412, and my name is Dr. I Feel Good, and my cell phone number is 713-888-9999. The patient is on their way, so please get ready. They also don't have insurance, so they'll be paying with cash. Thank you.
That sounds shady. So let's see. The doctor's calling in 3 controlled substances, using street names for drugs, asking for specific colors and brands, mispronouncing things, and the DEA number is invalid. See, when we get suspicious prescriptions like this, we have to get the doctor involved and sometimes the police. So as you can imagine, this takes up a lot of our time during the day.
The next station is the pickup station. This is where you pick up your prescription and pay for it.
At pickup, we ask for identifying factors when the guest comes up, such as a name, date of birth, phone number, and an address.
Did you catch that? Let's listen to it again.
At pickup, we ask for identifying factors when the guest comes up, such as a name, date of birth, phone number, and an address. This is also where we collect the payment for their medication. Lastly, if anybody wants to purchase any products containing pseudoephedrine or Sudafed, they would ask us what they want, and then we get it here behind the counter. Lastly, we'll send the guest that has any questions over to counseling.
The last station is the counseling station. This is where the pharmacist provides important information about your medications, as well as answer any of your questions.
Okay, there's 3 steps to remember when you're at the patient consultation. First, stay engaged with the pharmacist, because we're focusing all on you. Secondly, let the pharmacist know if you're confused about anything, because remember, we're talking about your healthcare. And finally, don't be shy. There are no dumb questions, so ask away.
That's all, folks. Thank you for exploring the pharmacy with us today.
I'm a camera shy. Yes.
Simple your prescription.
Otras farmacias y compañías.
So the last step of the pharmacist fair.
So sorry.
And 2. Doctors oftentimes take a few takes. You ready?
Yes.
Oh, hi there. I can't because I see you smiling.